I've always been asked a lot of questions about plastic surgery because I myself have done 2 nose jobs and 2 sort of eyelid surgeries where I cut my double eyelids to be a little bit higher and cut the sides of my eyes, or the outer corners of my eyes, to be a little bit longer. And I've also done other things like Botox and fillers. So I guess a lot of people are asking me a lot of questions about plastic surgery because they themselves are interested or something like that. And I thought today I would just answer some of the most commonly asked questions because there are a lot of questions asked and nobody are answering those questions. I don't claim to be an expert or encourage anyone to go for plastic surgery. If you want to, that's your business, okay? I neither encourage or discourage it. Alright, let's start with the questions. One of the most commonly asked questions is about the scarring. So, where do you get scars when you do a nose job? Okay, for me, I have a scar right here. I don't know if you can see, but it's right in between my nostrils in this like middle thing called the columella, and that is where the surgeon cut the nose so that he can sort of open up my nose to do the implants inside and fix whatever he wants to fix. I also did Rhinoplasty, which is another kind of nose job where you know these like 2 things on the side, these 2 pieces, okay? They're called ala, which in Latin means wings of the nose. So basically I found that like my nose was a little bit too wide, and okay, here's a before photo to show you how wide it is. And so yes, I wanted to cut the side, so he actually took out a wedge of tissue from here and from here, and he just, you know, it's like a slice of pizza, and then you just cut it out, and he toasted the rest of my nose away and sewed it up. Okay, so the next question is, what exactly did I do for my first nose job and my second nose job? And why did I want to have a second nose job if my first nose job was already okay? Basically, I did my second nose job because I thought my first nose job was a little bit crooked, and here's the picture to show you how crooked it is. But basically, I also didn't like how the tip was a little bit squashed in at the side, so I wanted the tip, which is here, to be a little bit higher. So to explain myself, the first surgery, my first rhinoplasty, I had an implant put in and my alas cut, and also the tip of my nose reduced. When I did that surgery, I was very unhappy with my previous nose, and I just basically wanted it smaller. So I told my surgeon, just smaller, I don't care what else you do. I don't need it to be extra sharp or extra high or anything like that, just freaking make it smaller because it's so fucking humongous. So basically that's what he did. And the second time round, because it's crooked and because this time round I guess I'm a little bit more knowledgeable of what kind of nose I want, I told him I wanted a higher tip. So basically the second time round he did this. Okay, I drew a picture because it's really hard to explain. So basically this is what it is, okay? So this is my nose, okay, anybody's nose. You have a cartilage here about the shape of a parallelogram. So basically you don't need the whole piece of cartilage because it's really big. So he took out this cartilage out of my own nose and he cut it here like this, something like that. I'm not sure if you know I'm slandering him here, but basically he cut it and took out this extra piece right here and used this piece to modify it into little pieces like that, okay, and inserted it into, okay, this is the nose like this, okay, he inserted it into the columella to make the columella look higher, and as well as use some of it to build a little bit of a tip. So basically that's what my second nose job did. So now my nose is a little bit higher and I think the tip is a little bit higher too, which gives a little bit of a butter nose effect, which I really like. And that's not to say I don't like my previous nose job, I do, and I think both times around my surgeons are very good, and I'm very thankful for that. And they may be or may not be the same person, but I cannot say because it is some kind of like Ministry of Health violation if doctors advertise for their shit, so whatever. What are some of the implants that I use? You can either, for nose jobs, use a straight implant, just a very basic straight implant, or an L-shaped implant. Okay, some people prefer to use the L-shaped one, some people prefer to use the straight one. For my surgeon, he told me that he doesn't use L-shaped implants because it's very easy for the implant to get warped. And by warped, I mean like at the tip, right? Because it's L-shaped like this, it tilts like this to the side. So from the bottom, you can clearly see it's like moving to the side. And I think that's what happened to Dawn. So she only takes pictures from one side. Mine is a flat implant. Okay, and this implant rests on my nose here, and yes, if you touch it, you can actually feel the groove of the implant because there's a line here. And you can often see that people who have nose implants, when they take photos, right, there is a line along their nose, so that's a telltale sign, because a natural nose will never have a line there like that. Okay, the next question is, how does your nose feel like? Does it feel really hard and artificial? I guess the answer is yes, it kind of does. For people who have implants, yes, it's a little bit harder, and because I have all this cartilage inside my nose tip right now, it does feel quite hard. So when I touch it, I think it's quite hard lah. It's about as hard as maybe your knuckle. Yeah. The next question is, how painful is it? And that's the most popular question. To answer that question, I guess it depends on whether you do local anesthesia or general anesthesia. And of course, general anesthesia is more expensive, but if you do local, it means that your doctor would have to inject all these injections into your face before he gets started on his surgery, and I think those injections are pretty painful. But they're still tolerable, you know. I didn't like, you know, scream and yell or ask him to stop or anything like that. So there was this one particular jab that was really painful, and it was through my columella, which is through here. And wow, that was like freaking fucking painful. I was like whimpering a little bit. But the rest of the injections, even those through my gums, I know it sounds very terrible, but those are really okay. Is plastic surgery really addictive? I would say to a certain degree, yes, but not in a scary way where you can't control yourself, because after all, you need money and you need recovery time, and you know, people around you to sort of agree to you doing it. So there are so many other factors that will stop you, and there's also this fear that your surgery may not be necessary or it will turn out bad. So in a way, it's not really addictive, but I can understand where that notion comes from, because once you have started, what's going to stop you from doing the next? You're not all natural anymore. There's no point in being completely natural. You might as well go fix something else that you want to fix. But I would say that a well-balanced individual who doesn't have like body dysmorphic disorder or whatever it's called will probably not keep doing surgery. How long is the recovery time for a nose job? It depends on whether you have an internal surgery or external surgery. If you have an internal surgery, it means that your implant is just inserted into your nose bridge from your nostrils, which means that the stitches are inside your nostrils. So basically, that would mean that you have no external scar for you to have to recover from. So I would say in 3 or 4 days, perhaps you can just go out and your nose might look a little bit swollen, but still nobody can tell whether you have scars outside. If you have an external surgery, then that means there'll be stitches done on your columella and perhaps a bandage on your nose, and that will take perhaps a week for the stitches to come off. You have to go back to the surgeon to remove it. After that, you can sort of go out, and maybe in another week's time, which is like 2 weeks after the surgery, you can start to put makeup and concealer on your nose. It will take about a month for the swell to fully go away and your nose to look optimal to go out with, without having anyone say, how come your nose is so fucking huge? Can you smell blood during the surgery, and did it smell like bacon? Yes, I could smell blood during the surgery. I didn't think it smelled like bacon, but it definitely smelled like some kind of pork. Yeah, like maybe a roast pork, but not so delicious, like, you know, like if you just boiled pork or something like that. I can definitely smell it. Yeah, I could smell my own flesh. It was kind of morbidly cool.